Welcome to this week's video. You asked the questions. Back again with Dr. Flores to talk about all things knees. Pause for intro. Not all things. We're going to talk about some things with the knees. Knees are a little bit simpler joint. They don't have quite the range of motion of the shoulder like we talked about, right? So that means less problems. The less something moves, the less problems it can have, right?
Not so much. Actually.
I mean, does anybody come to you with how many forearm issues can you have? Your forearm barely moves.
Okay, yeah.
Not elbow, forearm.
Forearm. Oh, you're
Muscle
right.
or tendon, right? No, I'm just saying. I don't know. What do I know? So anyway, we're talking about the knees today. I don't think we don't inquire into this one quite as much anymore, but when I see it, it aggravates me because I feel like it's very preventable. Mm-hmm. So what are some of the most common causes of knee pain?
Okay. Most common causes of knee pain is primarily too much stress on the tendon.
Okay. Too much stress out. How are they stressing it?
Okay. Stressing would be.
We all hear the knee way out over the toes and shear pressure. What's this mean? What's this pressure on the tendon?
Well, actually, what you just said, the shear, all that stuff is 100% correct. Mm-hmm. The majority of the time, what happens is you have your quads, and then you have your lower leg, but you have that kneecap. Right underneath that kneecap, if you ever kind of try to do a leg extension, you can actually feel that tendon go from the bottom of your kneecap to the front portion of your tibia. And that's where a lot of the pressure comes from, because if you think about it, it's just that tendon is moving the whole bottom leg. So it's that shearing pressure, it's that acute pressure, it's that chronic overuse that happens to really affect that area and inflame it. For instance, if your quads are too strong, your kneecap may go high, put some more pressure on that tendon. Number two, patellar tracking issues. Okay, you may have, I'm not sure if you ever see guys, they have these huge teardrops on their quads on the inside. The outside, they don't have any muscle or whatnot. Because what happens is the quads are four muscles, but they have to be balanced. So I see a lot of people, they either favor the outside of their quads or the inside of their quads, and then the patella is not gliding right or not sitting in the center balanced.
Okay, so it's getting off in the alignment of the entire leg.
Exactly, because it has to stay aligned.
Okay.
Because if it isn't, then we have issues.
All right, so let's step outside and we'll see what are some things we can do to kind of fix or assess or whatever else with this problem, right?
Sure. We're going to talk about the knee fixes or whatnot. Just before, I talked about patellar tendonitis and patellar tracking issues. The most common thing that we see with the patella is a tracking issue, along with the tendonitis. So, what happens is we have to think about the patella right here sits right over the femur and the tibia. But we have a quad. Quad 4 has 4 muscles. So we have one on top, nice flexing here. And then what happens is we have one underneath, we have one on the inside and one on the outside. What can happen is if you favor something and you have a muscular imbalance, okay? Let's say that his patella comes over this way. Sorry if that feels a little uncomfortable. It's being pulled to the outside more. Most people, most clients, patients will sit there and be like, "Doc, I squat and it hurts like heck." So all I'll do is I will just have him squat normal, legs have to squat normal, and if they say that still hurts, he comes back up and whatnot. Now all I do is I have him do a half squat, because when they go all the way down, it's kind of hard to assess it. So if he has an issue on the outside, all I do is relax. I push it more to the inside. I'll have him do a half squat parallel right there. And the majority of the time, they'll sit there and say, the pain's gone. So that is when you do two things. You either try to balance the muscles yourself, or you come to a place like Veritas Strength and Conditioning and you say, hey, my outside is weak, I need to strengthen it, and they can help you with that. Because the majority of the time, the reason why is because there's an imbalance. Now we're going to talk about patellar tendonitis, or some people call it jumper's knee. But it's most of the time happens when people explode in any kind of movement. Box jumps, leg extension, squats not so much. But what happens is, in order for the leg to come up, the quad has to flex. So this actually has to flex. But it uses the kneecap as a pivot joint. So we have our quad, we have our kneecap, we have our lower leg. Between your kneecap and your lower leg, you have your tendon. Okay, I want you to push up against my resistance that way. Okay, most patients will say, hey, doc, that hurts. All I will do, very simple, is I will take my thumb right underneath it, press down, press up again, the pain goes away. The reason why is because the tendon is not being used as much. So what we do for this is rest, ice, lower weight, lower frequency, and you can even use a Chopac brace. That's just a brace that goes right across the tendon. It will push down on the tendon and decrease that stress or that load on it.